over 200,000. It also serves neighboring sub-counties such as Nyamira, Nyagach, Nyando, Kasipul, Kapondo, etc. The hospital offers both outpatient and inpatient services. In addition, it provides specialized clinic through MOPC, MOPC. However, there are a lot of referrals to Kericho County Referral Hospital, which is 40 kilometers away. This is basically because the laboratory services offered are basic and major tests are not carried out because of lack of specialized equipment required for diagnosis. Currently, the X-ray department is operational. Theater completion is at an advanced stage. That's the need of a surgeon to facilitate its full operations upon completion. On infrastructure, Mr. Speaker, the hospital consists of an old healthcare center model with both OPD and general inpatient and maternity with a 24-bed capacity. It also has new ultra-modern 90-bed capacity ward with a laboratory X-ray and an ultra-modern 24-body capacity mortuary. Alongside these are 33 staff houses, 32 type E and 1 type D. All are yet to be commissioned. The old health center model includes 8 units of staff houses which require major renovations. The following were noted during the visit as hospital achievements: drilling of water, opening of radiology department, transfer of patients to the new wing, daily review for inpatient and maternity, improvement in laboratory services, i.e. complete blood count, quarterly adolescent clinic, improved FIF collection, dedicated health workforce, 24 hours inpatient and outpatient services, except pharmacy and laboratory, supervisory support to health centers and dispensary in Sigawet and Soin sub-county. The following are challenges faced by the facility. Mr. Speaker, sir, power outages. The power supply in the facility should be cheap and sustainable, and we recommend solar power complemented with an upgrading of the current generator up to 315 kV to cap constant power outages in the facility, Mr. Speaker. Operating theater. The operating theater is complete with one anesthetist in place. The facility, however, needs to be staffed with an additional anesthetist, a surgeon, and a theater nurse for it to be fully operational. Mr. Speaker, sir, inadequate staff. The facility is categorized as a level 4 hospital, and as per the human resources for health norms and standards guidelines for the health sector, Ministry of Health of August 2014, there exists gaps in staffing. The county government needs to improve on equipping the facility with adequate staff, besides need to continually focus on staff capacity building and on job trainings. See Annexures 2, extract of the guidelines. Upgrading of OPD and establishment of a casualty unit. There is need to upgrade the outpatient department and establish a casualty unit in the hospital due to its strategic location along Kapsoit-Tondo Highway. The Speaker, sir, on transport, there is need for the hospital to have an additional vehicle to facilitate supervision of lower cadre facilities. Information Communication Technology, ICT. The hospital has embraced modern technology through introduction of local area network, that's LAN, in order to improve information, processing, communication, and decision making. There is need to embrace modern technology through acquisition of more computers for information, processing, and communication in key areas of service delivery. Namely, a patient data and information exchange for reception to all service points, automated collection of revenue, ease in information exchange, prompt filing of returns and other statutory reports requirements. Mr. Speaker, sir, Sociot Health Center. The committee visited Sociot Health Center on 29 February 2024, which is located in Belgut Sub-County, Waldai Ward. It is a level 3 facility with a workload of approximately 200 patients per day. The committee made the following observations. The facility has 3 clinical officers and 10 nurses. The facility is clean, Mr. Speaker, sir. Number 2, very important point. the facility is clean and orderly. Some laboratory machines are obsolete, and the department needs to allocate funds to replace them. Mr. Speaker, sir, the maternity wing has 2 delivery beds, and yet it serves more than 10 mothers per day. Mr. Speaker, sir, despite the laboratory being well equipped, it has no permanent staff from the health department, and the facility depends on 2 staff on contract and 1 volunteer. Mr. Speaker, sir, the facility has complete male and female wards with beds and all other necessary items, Mr. Speaker, sir, but it is not functional due to lack of staff. The hospital has requisite structures to upgrade to level 4 facility, Mr. Speaker. Ad-hoc committee hearing. Mr. Speaker, sir, under Kericho County Assembly Standing Order number 186, committee shall enjoy and exercise all the powers and privileges bestowed on the Assembly by the Constitution and Statute, including the power to summon witnesses, receive evidence, and to request for and receive papers and documents from the government and the public. The committee, having drawn its powers from the above provisions, summoned the following officers from the county executive on a fact-finding mission on the highlighted matters as raised in the communication. The following officers were invited to make their submissions before the committee. 1. County Public Service Board Secretary, County Public Service Board Chairperson, County Pharmacist, Head of County Procurement, Procurement Officer, Head of Payroll, Head of County Health Infrastructure, Head of Projects as well, Head of County Revenue, Nurse in charge, Kapkatet Sub-County Hospital, Nurse in charge, Kapkatet Sub-County Hospital, Medical Superintendents, Mr. Speaker, sir, for all the 6 sub-county hospitals. Note that. And number 11, medical administrators, Mr. Speaker, sir, for all the 6 sub-county hospitals. Note that also. Relatives, family members of the deceased persons from Kapkatet and Roret. County Executive Member for Health Services. Chief Officer Health. Head of Payroll, Mr. Duncan Mutai. The head of payroll appeared before the committee on 1st March 2024 in honor of the invitation by the committee, answered questions regarding payroll. He informed the committee that there are 1,642 health workers, both medics and non-medics. Let me repeat that part, very important, Mr. Speaker. He answered questions regarding the payroll. He informed the committee that there are 1,642 health workers, both medics and non-medics. Mr. Speaker, sir, where 807 are under permanent and pensionable terms. Note, 835, Mr. Speaker, sir, personnel under contractual terms. Since 2018, Mr. Speaker, sir, and 205 staff are working under Facility Improvement Fund, FIF. Mr. Mutai informed the committee that the wage bill for the county is at 42%, which exceeds the recommended 35%, which is by about 7%. The committee learned from the engagement with him that the remuneration of health care workers who are non-medics is as follows. Those ones with a degree, Mr. Speaker, sir, they earn 42,370. Those ones with a diploma, Mr. Speaker, sir, they earn 36,700. Those ones with a certificate, Mr. Speaker, sir, they earn 31,160. Support staff, Mr. Speaker, sir, they earn 20,601. Medical staff is as follows, Mr. Speaker. A medical staff with a degree is 56,720. A medical staff with a diploma, Mr. Speaker, earns 37,170. While that with a certificate, Mr. Speaker, earns 33,160. On confirmation of healthcare workers recruited between 2018 and 2020, to permanent and pensionable terms, he reiterated that the County Assembly should consider, Mr. Speaker, appropriating more funds that will also facilitate the employment of more healthcare workers. Such collective responsibility will only improve their welfare but also motivate them, thus enhancing their service delivery. Mr. Speaker, sir, County Public Service Board members. The County Public Service Board members, led by the Chairman, Professor Koech, and CEO, Secretary, Mr. Speaker, sir, Mr. Charles Chirchir, appeared before the committee on 1st March 2024. They informed the committee on their mandates as established under Section 59 of the County Government Act 2012, that the board not only recruits but also promotes and confirms employees of the county government. They further informed the committee that on exercising their functions, they received a letter from Mr. Speaker, sir, the Chief Officer Health, on the request of replacement and recruitment of healthcare workers. That before starting the process, they did a letter to CEO Finance to confirm the availability of funds. It was elaborated that the exercise did not go through or did not go on after the CEO Finance wrote to County Public Service Board, and we have annexed a letter, Mr. Speaker, sir, 3 A, B, C copies of letters from the CEO Health and CEO Finance and their correspondences. The exercise was stopped through it. It was though it was in advanced stage of shortlisting applicants. They informed the committee that they do recruit employees based on availability of funds from the relevant department and in adherence to regulations. It was noted by the committee that funds amounting, Mr. Speaker, sir, to Kenya shillings 3 million was expensed through the process, which was halted due to advisory from the Chief Officer, Finance and Economic Planning, citing reasons from revenues to effects on wage bill. The board informed the committee that it was difficult to act after the advisory. They notified the committee that both CEO Health and CEO Finance and Economic Planning sit in a body called CHRMAC, where CEO sits, chaired by the county secretary. It was difficult to understand how CEO for Economic Planning, Mr. Speaker, sir, could write to County Public Service Board, Mr. Speaker, sir, contrary to what was passed in the CHRMAC meeting, Mr. Speaker, sir. The board admits that there is acute shortage of staff in health department, and their request is the county assembly should appropriate, Mr. Speaker, is a very important part, 400 million for confirmation and recruitment to cap the shortage. County pharmacist, Dr. Koriri Manuel. The county pharmacist appeared before the Ad-hoc committee on Monday, 14 March 2024 to give information regarding the status of healthcare services in the county. As far as matters drugs is concerned, he informed the committee that he is in charge of pharmaceuticals and non-pharmaceuticals for level 2 and 3 hospitals. He consolidates orders for procurement, and this financial year, the total funds for pharmaceuticals and pharmaceuticals, Mr. Speaker, is Kenya shillings 131,090,670 and Kenya shillings 44,232,073, respectively, to a total sum of Kenya shillings 175,322,743, and as at February 31st, 2024, a total of 139,740,727 has been expended. Mr. Speaker, sir, the committee understood from the engagement that under first quarters, a total of 24,716,817 was procured from KEMSA and METS, and local supplies for quarter 2 and 3 of Kenya shillings 110,083,910. Dr. Korir informed the committee that the reason for resorting to local suppliers over KEMSA and METS are: 1, Mr. Speaker, failure by KEMSA to supply the orders as requisition, thus low fill rates. METS require upfront payment. Mr. Speaker, sir, the county pharmacist further indicates that the department is facing challenges of drugs tracking due to lack of logistic management system and currently using PIN cards, older system. Distribution to sub-counties is done on quarterly basis. Mr. Speaker, sir, Head of County Infrastructure, Health Project, Dr. Mugunu Hilary. Dr. Harry Mugunu is the Head of Health Projects and a doctor by profession, medical officer, appeared before the committee on 14 March 2024 to shed light on the health projects in the department. He informed the committee that the allocation for health projects is Kenya, for projects in the financial year 2023-2024 is Kenya shillings 170 million, 974, 157, and Kenya shillings 166, 867, 157 for construction and equipping of health facilities, respectively, to a sum of 237 million, 841, 193, and Kenya shillings 166 million for construction, being expended truncating to 97.1% absorption rate, and Kenya shillings 58 million has been utilized for equipping 94.2%, which is equivalent to 94.2%, and remaining 5.8% is yet to be committed due to non-responsive tenders. Medical superintendents. Mr. Speaker, sir, the committee invited all the medical superintendents from all the sub-county hospitals. The first to appear before the committee was from Sigawet Sub-County Hospital. He submitted as follows. That is Dr. Peter Mugun. He informed the committee that Sigawet Sub-County Hospital is a high-volume facility serving the better part of Soin, Sigawet, Kisumu, and Homa Bay counties. The facility offers curative, promotive health, PCH, among other services. The personnel at the facility is as follows. Mr. Speaker, sir, they have got 10 specialists, doctors. They have 42 nurses, 9 clinical officers, 2 pharmacists, 6 technicians, 1 mortician, and 1 volunteer. Cleaning, security, and catering services are contracted. Staff shortage is as follows. Mr. Speaker, sir, the facility requires 3 specialists. The facility requires 44 nurses, Mr. Speaker. The facility requires 4 more clinical officers. They also require 2 more pharmacists. And they also require 7 laboratories. In the laboratory department, they require 7. The facility used to source oxygen from BOC Kisumu under donation from Abraham, but is currently sourcing from Kapkatet Hospital free of charge. It was observed that they last sourced it from Kericho County Referral Hospital in November 2023. The revenue target, Mr. Speaker, sir, members, the revenue target for this facility for the financial year 2023-2024 is 59 million as at the end of February. By then, by this day when he appeared, it had managed to collect 26 million. It denoted that NHI reimbursement is not done in time, Mr. Speaker. They managed to waive a total of 482,671. Mr. Speaker, sir, medical superintendent, hospital administrator, and nurse in charge for Kapkatet Hospital. The management of Kapkatet Sub-County Hospital, led by medical superintendent Dr. Daniel Koech, appeared before the committee on 5th March 2024 to give the information regarding the status of healthcare in their facility. He informed the committee that the facility has, Mr. Speaker, sir, 273 personnel spread across all cadres. The facility had a revenue target, very important to note, a revenue target of Kenya shillings 141 million. And as of 31st February, Mr. Speaker, sir, the facility had collected 80 million, 514, 307 as F5. The oxygen plant at the facility is utilized in the facility and outsourced to Kericho County Referral Hospital, Roret Sigawet, and Londiani Sub-County Hospitals. It was also from the deliberations that the committee learned that the mortuary at Kapkatet has a capacity of 24 bodies, though it lacks cooling system, which broke down, Mr. Speaker, sir, in the year 2019. The medical superintendent explained to the committee that the workload is immense and the workforce therein is overwhelmed. Mr. Speaker, sir, due to acute shortage of personnel across all the cadres, Medical Superintendent, Roret Sub-County Hospital, Dr. Collins Kimutai, the Medical Superintendent, Roret Sub-County Hospital, appeared before the committee to give information regarding status of healthcare service at Roret Sub-County Hospital. The facility serves a population of 22,000. Its medical supplies are sourced from KEMSA, MEDS, and other local suppliers. They get the oxygen from Kapkatet Sub-County Hospital. Dr. Collins appreciated the committee for the gesture, indicating that the only way to understand and appreciate challenges faced by facilities is by field visits and even invitations to that prompted him to appear before the committee. He even went ahead to quote the scripture on coming to a round table to reason together with the committee. Isaiah, Mr. Speaker, 1:18, come now, let us reason together, says the Lord. Londiani Sub-County Hospital, the management team from Londiani Sub-County Hospital, led by Dr. Collins Kipkoech, alongside hospital superintendent, appeared before the committee, providing information requested on the status of healthcare system in the facility. They explained to the committee that the facility is using FIF in its operation. It collected in the facility through M-Pesa Bay Bill, which is channeled to facility account, and that transferred to the county revenue fund, CRF. And same is requisition via AI request for the operation of the facility. He submitted that the facility has collected 10,904,499 as revenue under FIF and 19,217,906 from NHIF and other insurance companies. It also recorded Kenya shillings, very important to note, 850,580 as waivers. Mr. Speaker, sir, for Tenan and Kipkelian Sub-County Hospitals, the officers in charge of Fortenan and Kipkelian Sub-County Hospitals appeared before the committee to give information on status of healthcare services in the facilities. They informed the committee on the challenges facing their facilities, such as understaffing, Mr. Speaker, inefficient drugs, and inadequate development. They further informed the committee that Fortenan Sub-County is a high-volume hospital in Kipkelian West, Mr. Speaker, sir, with 50 personnel only. The facility is facing challenges of understaffing, making it not to operate optimally. Mr. Speaker, sir, Kipkelian has 45 staff spread across all cadres and has challenges of staffing too, and lack of water in the facility, Mr. Speaker. They've collected revenue of 1,126,582 as FIF. Mr. Speaker, sir, the head of revenue, Mr. Stanley Koech, is the acting head of county revenue who previously worked as an accountant at Kapkatet Sub-County Hospital. He informed the committee on the status of revenue collections in the county, particularly health department. In his oral submissions, he informed the committee that the following are revenue collected as at 29th February 2024, Mr. Speaker, sir. Okay, that's facility up there, sorry. FIF, SHIF, and other insurances, totals. So, Mr. Speaker, sir, very important to note also, Kericho County Referral Hospital, 76 million. FIF is 76 million, 491,664. And then on SHIF, Mr. Speaker, sir, they've collected 86 million, 834,897. And on others, insurances and the rest, 163 million. That's the total. 163 million, that's the total, Mr. Speaker. 163, 326, 561. Kapkatet, Mr. Speaker, sir, their FIF is 43, 690, 317, 38, 624, 114, which is 82, 314, 431. Londiani, Mr. Speaker, 10, 904, 499, 21, 314, 707, 32, 219, 206. Sigawe, 12, 396, 249, 13, 661, 086. total 26,057,335. Rorate, 3,641,475. 2,665,415, total 6,296,890. For tenant, 2,858,880, 2,776,149, total 5,635,029. Kipkelion, 762,951, 1,358,127, total 2,121,078. Mr. Speaker, sir, total F5 is 150,746,035, while SHIF is 167,224,496. Total, Mr. Speaker, 317,970,531 as revenues in our health facilities. The members learned from the deliberations that the mode of payment for all services is cashless through M-Pesa pay bill number to facility account, and same is transferred, Mr. Speaker, to the county revenue account, CRF, on monthly basis. The head of revenue highlighted the following challenges in revenue collection in the county. Mr. Speaker, sir, 1, shortage of revenue clerks, no adherence to Finance Act due to poor enforcement. Mr. Speaker, sir, lack of revenue management systems. Specific observations and recommendations on response to the terms of reference. On term of reference 1, which is the status, confirmation of health personnel and other staff as budgeted in the financial year 2023-2024. The committee observations, Mr. Speaker. Mr. Speaker, upon interrogating submissions and documents availed, Thank you, Mr. Speaker. I had bent for long. Upon interrogating submissions and documents availed, the committee made the following findings and observations. The Kericho County Public Service Board is a constitutional body established under Article 235 of the Constitution of Kenya 2010 and the County Government Act 2012, with a mandate for staffing of county governments and provision of human resource policy. Therefore, it is an employer of the health personnel in this matter. Thank you, Mr. Speaker. To bastion the mandates of the board, Section 591B of the County Government Act 2012 reads, appoint persons to hold or act in offices of the county public service, including in the boards of cities and urban areas within the county, and to confirm appointments. The committee observed that the board has the authority, Mr. Speaker, and the power to confirm appointments of health personnel and its suspension through the advice of the CCM Finance and Economic Planning, Mr. Speaker, was unlawful. It shows that the board did not act independently when it relied on the opinion advisory of the CECM, Finance and Economic Planning, and head of County Treasurer, via a letter dated 3rd January 2024. Yet, its independence falls under the ambit of the Constitution and Section 59A of the County Government Act, which reads, Mr. Speaker, in the performance of its functions, the County Public Service Board shall be independent and shall not be subject to the direction or control of any other person or authority, Mr. Speaker. In addition to that, the Constitution indicates that the board will maintain its independence in the management of public service. The act is so clear, Mr. Speaker, that the board shall not, and we have underlined that, be controlled by any person or authority. Underline the same. But in this instance, it shows that the board was controlled by the CECM Finance. After consultations with this CECM Finance and Economic Planning, the board suspended, Mr. Speaker, sir, the recruitment process. The board is guided by the above-mentioned provisions and should have discharged their duties and responsibilities independently without the control or interference of the executive or any other person. To that effect, the board is required, Mr. Speaker, to confirm the appointments of the health personnel. We've underlined confirm the appointments, Mr. Speaker, sir. Mr. Speaker, sir, further, the Department of Health, in its correspondence to the board, confirmed the availability of funds. Mr. Speaker, sir, for confirmation of the said personnel, we have attached, Mr. Speaker, Annexure 4, a copy of the extract from the budget. The contractual term for employees has been provided under Section 45 of the Public Service Commission Act, where the contractual period should not, Mr. Speaker, sir, and let's underline, should not exceed 5 years. In this case, some have exceeded 5 years, Mr. Speaker, sir, from 2018. The committee therefore observed that some of the medical staff in our county have been in contract for over 10 years, which is contrary to the labor and public service laws. In this regard, Mr. Speaker, the board should hasten the process and confirm the personnel within the shortest time possible, Mr. Speaker. Mr. Speaker, sir, the committee also observed that the County Assembly had already appropriated funds for confirmation of staff at the Health Department. Mr. Speaker, sir, we've also annexed Annexure 5, a copy of the budget. The county executive had never responded via a memorandum, but instead His Excellency the Governor assented, Mr. Speaker, to the appropriation bill as it is. Further, the committee observed that the funds budgeted for confirmation was not only for the Health Department, but also for education, which is outside our mandate, Mr. Speaker. For the CECM Finance to object confirmation of the Health Department staff and allow confirmation of ECD caretakers was discriminatory. Underline that part, Mr. Speaker, sir. Committee recommendations. Mr. Speaker, number 1, the board should confirm the medical personnel, Mr. Speaker, sir, within 30 days and submit the report on the same, Mr. Speaker, sir, to the County Assembly of Kericho. The non-performance of its duties and functions as mandated in the County Government Act should not recur in the near future. Mr. Speaker, sir, 2, in discharging its mandate on confirmation, the board should undertake suitability test with regards to those who have served on contract for inordinately long period of time and consider formally engaging them on 1, Mr. Speaker, sir, fixed contract for those above 45 years old and permanent and pensionable terms for those below the age of 45 years old. Mr. Speaker, sir, there is the county executive member for finance and economic planning, Mr. Speaker, sir, to come up with strategies to improve on revenue collection so that the high wage bill can be addressed. Mr. Speaker, sir, the other terms of reference, status of implementation of the funds set aside in the financial year 2023-2024 for purchase of specialized materials, including medical drugs and non-pharmaceutical medical items. The committee observations, Mr. Speaker. The department was allocated funds for specialized materials for level 2 and 3 as follows. Medical drugs, 159,596,71. Dressings and other non-pharmaceutical medical items, 44,232,073. A total of 203,822,744. Mr. Speaker, sir, the Department of Health has procured medical drugs and dressings and other non-pharmaceutical medical items for the last 3 quarters, which totals to 139,740,727. The procurement in the 2nd and 3rd quarter was done under framework contract. This leaves a balance of 64,082,017 that will be utilized in quarter 4, Mr. Speaker. Below is a breakdown of drugs supplied per quarter. Quarter 1, 24,716,817. That's for medical drugs, non-pharmaceuticals, and lab reagents. All the beneficiary for this amount, Mr. Speaker, are all level 2 and 3 facilities. Fully delivered, payment in process, Mr. Speaker. For quarter 2, 59,913,240 medical drugs and non-pharmaceuticals, all level 2 and 3 facilities, including for Tenan Hospital, Mr. Speaker, sir. The same all have been delivered and have been paid. Mr. Speaker, sir, on quarter 3, 55,110,670 medical drugs and non-pharmaceuticals, all level 2 and 3 facilities and Kipkelian sub-county. Fully delivered, payment process yet to be complete, initiated. Mr. Speaker, sir, breakdown for payment of drugs in quarter 2 per sub-county. The total of 59 million we've broken down, Mr. Speaker, 59,913,240. In Amoy, they have paid 8,171,900. For Belgut, they paid 9,700,580. In Bureti, they have paid 12,062,030. In Kipkelion East, they have paid 7,593,910. In Kipkelion West, they have paid 7,144,240. In Soin Sigawe, they have paid 12,757,940. In Fortenan, Mr. Speaker, they have paid 2,482,600. Mr. Speaker, sir, the committee also received supported payments vouchers for second quarter amounting to Kenya shillings 48,970,590. The drugs for the third quarter is yet to be paid. However, the same has been captured in the internet banking system. Mr. Speaker, sir, apart from giving the reason of partial and delayed supply by KEMSA and request for upfront payments by METS, there is no evidence given to that effect. Mr. Speaker, sir, despite the department in giving reasons of low fill rate by KEMSA, they failed to illustrate by evidence as to why there was a change of suppliers from KEMSA and METS to suppliers who supply the commodities at exorbitant prices. Mr. Speaker, sir, 69% of what has been allocated for purchase of specialized materials have so far been utilized. Committee recommendations, Mr. Speaker. The department should ensure that they have exhausted every necessary step to procure specialized materials at the lowest price before exploring alternative modes of payment for the county to get value for money. Mr. Speaker, sir, the department should have proper procurement plan by procuring specialized materials a month before lapse of the quarter from KEMSA so as to improve on the fill rate. Mr. Speaker, sir, frequency of distribution of drugs in health facilities and breakdown of drugs supplied in all facilities for the financial year 2023-2024. These are the observations from the committee, Mr. Speaker. The committee observed the following. The Department of Health Services procures medical drugs and pharmaceuticals on quarterly basis. In the first quarter, the Health Department procured drugs and pharmaceuticals worth 24 million from KEMSA, which was directly distributed to level 2 and 3 hospitals. In the second and third quarters, the department made orders to local vendors through framework of 3 years from 2022. They were also distributed to all 2 and 3 facilities by vendors. Below is the table showing value of commodities applied to various facilities per sub-county per quarter, Mr. Speaker. The list is there. 24,716,817. To 59 million, quarter 2, 59,913,240. And these are to Ainamoy 8 million, like we had elaborated, Mr. Speaker. Quarter 3, 55,110,670. Mr. Speaker, sir. And then the medical drugs, the Ainamoy 6,482,320. Belgut. That's for medical drugs, Mr. Speaker, sir, non-pharmaceutical and lab reagents. I had read the other one. So for Ainamoy, 6,482,320. For Belgut, it's 7,585,240. Bureti, 9,954,880. Kipkelion East, 7,149,400. Kipkelion West, 6,107,000. Soin Sigawe, 9,764,040. The county Baverstock at 6,066,700. Kipkelion Hospital, 2,001,010. The following is a list of pre-qualified suppliers for supply and delivery of pharmaceutical and non-pharmaceutical under framework agreement, Mr. Speaker. The list of pre-qualified suppliers for the drugs, farms, and non-pharmaceuticals. Nile Pharmacy Limited, the address is there. Ad-hoc Healthcare Limited, National Pharmacy Limited, Adakim, Allied Corporation Limited, Diagos, Eldobase, Rokij Atot, Enterprises Inspire Pharmaceuticals, Tembur Central Chemist and Company Limited, ABC Pharmacy, Remicroft Limited, Sajivin Limited, Med Support Africa Limited, Maxling Healthcare, Totaned Enterprise, Veteran Pharmaceutical Limited, Trufen East Africa Limited, Stamed Healthcare Limited, Linkis Kenya Limited, Agoton Limited, Kericon East Africa Limited, Thrive Pharmaceuticals Limited, Avia Care Pharmacy Kericho, Tokra Limited, Netala Limited, Ecta Limited, Angelica Medical Supplies Limited, Chovlosta Investment Limited, Cointany Limited, Elementaita Pharmaceutical Limited, Isopharm Limited, Joanna Medical Services Limited, Africa King Supplies Limited, Selfam Healthcare Limited, Senamed Pharmaceutical Kenya Limited, Zawadi Healthcare Limited, Medox Pharmaceuticals Limited, Kolongai Chemist, County Chemicals Limited, Dan Sites Olnex Limited, Krayak Limited. The Speaker, sir, and the addresses listed above. The beneficiaries, facilities for the medical and non-pharmaceutical drugs are as listed below. Ainamoy Health Center, which is in Ainamoy. The Speaker, sir, GK Prisons Dispensary, Kericho, which is in Ainamoy. Manyoro Dispensary, Ainamoy. Kericho Municipal Health Center, which is also in Ainamoy. They are listed, Mr. Speaker, as per sub-counties, not wards. Chesanga Dispensary, which is in Ainamoy. Kabkiam Dispensary, Ainamoy. K2 Dispensary, Ainamoy. Kericho GK Prisons, Ainamoy. Kenego Dispensary, Ainamoy. Kapcheptoro, Ainamoy. Merta, Ainamoy. Kimungen, Ainamoy. Laliat Dispensary, Ainamoy. Chepkoya Dispensary, Ainamoy. Buchenga Dispensary, Ainamoy. Kapsaus Dispensary, Ainamoy. Samudra Dispensary, Ainamoy. Maso, Torsagek, Binyin, Jepso, Mulge, Luet, Kimeswan, Sosiot. All those are, except Kimeswan, all those are under Ainamoy. Then we have Belgut. Sosiot Health Center, that's Belgut. Kapsoi Dispensary is also in Belgut. Kabianga Health Center, Je Moro Road, Kabianga Tea Farm, Je Kosilen, Kagiptui, Kapsiya, Kapsuser, Kaborok, Cheronget, Seretet, Sanga, Kaptoboiti, Chebirirbe, Keben, Chepkoton, Kablutiet, Kamawoy, Nyabangi, Kapkures, Kiptome, Sajoran, Koiwalelach, Kiblalmat, Machorwang, Ainet, Kiptaldal, Kipsolu, Jeborge. Okay. Kipsalu, Chemosot, Kipwas. Okay, now the last one for Belgut is Kipsalu Dispensary. Then we begin Buret. Buret is Cheborge, Chemosot, Kipwastuya, Litain, Sosit, Kenene, Chepterwa, Tebesoni, Kalaja, Cheblanget, Kiptewit, Mabasi, Chelilis, Kiptome Dispensary, Tuluet, Kapkisiara, Jeboin, Kapsogut, Shongi, Kibugat, Kaboita, Boutique, Mosore, Ngaina Road, Chemoiben, Kabitungu, Getarwet, Rungut, Kelunet, Kabroret, Kabriret, Cheribo. Civil servants, district, DC headquarters, that's America, Kaldi, finally Gabarus, all those are in Buret. Then we begin to kill your list. Momoniat, Kidawa Chagoror, Gimot, Yipsir Lomotit, Gimogul, Masaita, Mititatu, Kamwingi, Girenget, Yezinende, Chebewar, Mugumoini, Kapsenda, Subukia, Kapsegir, Chepcholiet, Tirisach, Ibrengwe, Jepseon, Gongoni, Kericho, Forest Dispensary, Giletien, Kitol, Kitoy, Taragon. Now we begin Kipkelion West. Kipkelion West, we begin with Kitoy Dispensary. Taragon, Kap Queen, Ngendalel, Songonyet, Kunyak, Makyola, Gashin, Lelu, Segetet, Lelechwet, Burutu, Mariwa. Cherara, Oisagat, Ipsegi, Chepkunyuk, Mentera, Benet, Timbilil, Sereng, Dubusat, Kaliet, Magire, Gipsinende, Tingatela, Gipter. Now, so we begin with Soin Sigawet now. All those ones I've listed are Kipkelionist. Kiptere Dispensary, Kipsitet, Nyalil Buch, Cheptuyet, Kibranye, Kabuti Matiret, Chep Kemel, Kaliongwit, Kaitui Dispensary, that's Kap Sorok, Kebeneti, Kap Chebwai, Ira, Kamaget, Soliat, Tibet, Chembagong, Kap Changa, Koitaburot, Koyat, Kiplelgutik, Kap Segut, Kap Kara, Subayot, Kap Keburu, Kimoson, Kamasega, Kap Kormom, Maemba, Ngetunyo, Kap Lelartet, Kap Kigoro, Kejiria, Tabaita, Kap Somboch, Yeloske, Jeb Korgongit, Kayuet, Kimorogo, Koyabi, Chabiagon. Those are the list of the dispensaries, Mr. Speaker, sir. At the total of 178. Mr. Speaker, sir, breakdown of medical drugs and pharmaceutical drugs for the above-mentioned facilities has been annexed in number 6. The committee recommendations. The department should be automated. The department, Mr. Speaker, sir, should use automated system to monitor the movement of drugs from the source to the end user and help in restocking these drugs as demanded, which is through the system, Mr. Speaker. All drugs should be received at the county medical stores. We noted some of the drugs are not received at the medical stores. They are taken directly by the suppliers. So all drugs, Mr. Speaker, sir, should be received at the county medical stores, and each sub-county pharmacist should receive the said drugs and personally supply them to all the level 2 and 3 facilities. This will ensure that each sub-county pharmacist is held accountable, Mr. Speaker. Status of implementation of development projects in the financial year 2023-2024. Committee observations. Mr. Speaker, sir, the committee observed the following. The County Assembly approved the budget. The County Assembly approved the budget estimates for the financial year 2023-2024 and the Appropriation Bill 2023 and the Appropriation Bill 2023. The bill was ascended to and published on 11th July 2023. It appropriated Kenya shillings 120,686,875. That's 120,686,875 for construction and completion of incomplete health facilities, and a further Kenya shillings 79,667,157 for equipping of facilities. 79,667,157. The Speaker, sir, proposed work. Proposed number 1. Proposed elevated 3,000 liters tank and 10,000 tank with a base of 22,500 liters septic tank, placenta pit for completion of maternity renovation of patients' toilet and renovation of staff housing at Cape Koi. The status is ongoing, Mr. Speaker. Proposed renovation of outpatient staff housing and fencing of Buchenga Dispensary, ongoing, Mr. Speaker. Proposed renovation and fencing of Maso Dispensary, ongoing, Mr. Speaker. Proposed renovation of maternity unit at Kimeswan Dispensary, Mr. Speaker, ongoing. It is listed as ongoing. Proposed construction of phase 1 maternity at Cap Cheptoro Dispensary. The Speaker, sir, it is listed as ongoing. Proposed renovation, fencing and gate at Municipal Health Center, they have listed it as ongoing. Proposed construction of maternity phase 1 in Kimungen. They have also listed as ongoing. Proposed renovations at Chesanga, ongoing. Proposed branding and signage of new facilities countywide. They have also listed it as ongoing, Mr. Speaker. Proposed construction of Ngainet dispensary. They have also listed as ongoing. Proposed construction of a 4-door pit latrine at Sanga dispensary and protection of placenta pit in Kamawoi dispensary. They have also, Mr. Speaker, sir, listed as ongoing. Proposed 3,000 liter race tank and 10,000 liter tank with a base with a base. Then renovations of staff house and repainting of outpatient department at Sachoran dispensary and plumbing works with minor repairs at Kapsuser dispensary. Staff house. They've also listed, Mr. Speaker, sir, as ongoing. Proposed renovation of staff house and addition of 5,000 liter tank, water tank, completion of kitchen, protection of placenta pit, renovation of outpatient department at Kagiptui dispensary. Mr. Speaker, sir, they've also listed it as ongoing. Proposed construction of Malinja dispensary, listed as ongoing. Proposed renovation of outpatient department and maternity at Cheblange dispensary and water tank at Trita Moita dispensary. They've also listed as ongoing. Proposed construction of a 4-door toilet and Mosore dispensary, ongoing. Proposed renovation and masonry work at Kapkatet Sub-County Hospital, completed. Proposed construction of staff house, phase 1 and Kiptome dispensary, ongoing. Proposed renovation of outpatient at Kelunet, completed. Proposed extension of 2 MCH rooms at Chepterua dispensary, ongoing. Proposed remodeling of outpatient and extension of waiting bay at Litain Health Center, ongoing. Mr. Speaker, sir, proposed fencing, tilling of outpatient department, construction of 2-door toilet, and renovation of old one at Kabitungu dispensary. They've listed as ongoing. Proposed renovation of maternity, renovation of all toilets, and construction of a 4-door toilet at Yamosot Health Center and elevated water tank at Moina Road dispensary. They've also listed as ongoing. Proposed new Kolonge dispensary, stormwater drainage fence, and gate at Sosi dispensary. Land issue. They've listed as it has a land issue. Proposed renovation of outpatient, department, water tank, base, construction, and water gutters at Kapseke dispensary. Ongoing. Proposed construction of 2-door staff latrine at Testai dispensary. Ongoing. Proposed renovation of outpatient and completion of staff house at Kamwingi dispensary. They've listed as tendering, ongoing. Proposed construction of 4-door toilet, fencing and gate, painting, 10,000 water tank and base and facility signage at Yepkendi dispensary. They've also listed as ongoing. Proposed fencing gate, toilet repair and facility signage at Margaret dispensary, ongoing. Proposed construction of Kamaua dispensary phase 1, ongoing. Proposed renovation of outpatient and remodeling of entry doors, plumbing works at trauma center at Kaitu dispensary. They've listed as ongoing. Proposed fencing, renovation of lab at Kapkigoro, and completion of outpatient at Nyalilbush, ongoing. Proposed renovation of outpatient, toilet, water collection, and fencing of Koitabura dispensary, ongoing. Proposed fencing of Koilsir dispensary, and renovation of outpatient at Mayamba dispensary, ongoing. Proposed construction of staff house and fencing at Yeptuya, ongoing. Proposed renovation and alteration works at Sigawet offices, ongoing. Proposed renovation and alteration works at Sigawe. Proposed completion of maternity water collection and soak pit at Kiblialguti, ongoing. Proposed completion of outpatient at Kapsomboy dispensary. The tender was non-responsive. Proposed renovation of outpatient at Kablela dispensary, ongoing. Proposed paint works at Kericho County Referral Hospital. They've listed as completed. Proposed KPLC electrification and wiring phase 2 of facilities needing transformers in Kipkelion East, West, and Ainamoy sub-counties. They've listed as ongoing. Proposed KPLC electrification and wiring phase 2 of facilities needing transformers in Soinsigawet, Buret. They've listed as ongoing. Proposed construction of Chemngetuny dispensary, ongoing. Propose relocation and construction of an incinerator house, servicing of the incinerator and replacement of parts fencing of the incinerator at Londiani Sub-County Hospital, ongoing. Proposed direction of Cabro at Mog driveway, Mog gate, waiting shed, patient walkways, and Londiani Sub-County Hospital, ongoing. Proposed masonry works and renovations at Kericho County Referral Hospital. They will say it is completed. Proposed construction of a septic tank and sewerage system at Londiani Sub-County Hospital, ongoing. Proposed construction of radiology unit at Fort Tenan Sub-County Hospital, ongoing. Proposed construction of an X-ray unit at Kipkelion Sub-County Hospital, ongoing. Proposed completion and equipping of a borehole at Kipkelion Sub-County, ongoing. Proposed retaining wall at the mortuary and landscaping at Kericho County Referral Hospital, ongoing. Proposed construction of a maternity at Chepkemel Dispensary, ongoing. Proposed renovation of facilities in Soliat Ward, ongoing. Proposed construction of lab waiting bay and a paved walkway and repair works at the Human and Blood Bank in Kericho County Referral Hospital, ongoing. Proposed construction of X-ray block in Ainamoi Sub-County Hospital, ongoing. Proposed construction of 24 body morgue in Fort Tenan Sub-County Hospital, ongoing. Proposed supply of equipment to new dispensaries and facilities, ongoing. Proposed purchase and supply of furniture to new dispensaries and facilities, standstill period. That's how they've listed. Supply and delivery of beds, lockers, lockers, linen, and mattresses for Ore dispensary ward, standstill period. Supply and delivery of ophthalmology equipment at Kericho County Referral Hospitals, standstill period. Supply and delivery of assorted medical equipment to health facilities countywide, standstill period. Supply, delivery, and installation of oxygen piping and manifold of Kapkatet, standstill period. Proposed supply of NPU equipment to KCRH procurement process, ongoing. Proposed fencing and stormwater management drainage at Sosi Dispensary, procurement process, ongoing. Proposed renovation, outpatient, and fencing of Chemoiben Dispensary, procurement process, ongoing. Proposed renovation of Kennegut Dispensary, procurement initiating. Proposed Kimngetun Dispensary, procurement initiating. Proposed phase 2 works in Kiptama Dispensary, procurement initiating. The Health Service Department operates 169 functional public dispensaries with 19 other complete but not operational because of lack of staff. The 6 other dispensaries are pending completion. The Ministry of Health regulates that, states that a dispensary should serve, note honorable members, a dispensary should serve 10,000 population per year. And the county currently has a population of 1 million. This means the county should be adequately served by 100 well-staffed and equipped dispensaries. This therefore gives a surplus of 94 dispensaries. Honorable members, know that part. The county has there are guidelines to guide the same. The county has 11 health centers, whereas Section 81C of the Health Services Act states that the county should have 30 health centers, one for each ward. Members note, the county has 11 health centers today, whereas Section 181C of the Health Services Act states that the county should have 30 health centers, which is equivalent to 1 per ward. The department has not upgraded any dispensary to a health center in the last 5 years, which is an area of concern, members. The county has 6 sub-county hospitals, of which some do not meet the threshold as stipulated in the Ministry of Health guidelines on norms and standards for health service delivery, 2006. i.e., that is, for example, for Tenan, Ruret, and Kipkelion. The committee also observed that some health facilities do not have constant water supply. Mr. Speaker, sir, the committee recommendations are the same. For the next financial year's budget, the department should freeze construction of new dispensaries as the county has surpassed its dispensary threshold as per the Ministry of Health guideline. Therefore, the existing dispensaries should therefore be adequately equipped. Mr. Speaker, sir. Let me repeat. Therefore, the existing dispensaries should therefore be adequately equipped. Promote the upgrade of dispensaries, Mr. Speaker, sir, to health centers to offer 24-hour maternity and other services, which should include weekend and holidays. The department should ensure that there are adequate staff and resources for the said facilities. The upgrade should be done equitably. Equitably, Mr. Speaker. Mr. Speaker, sir, in the next financial year, the department should provide the project monitoring unit with a utility vehicle for the efficient supervision of projects and service delivery, Mr. Speaker. Mr. Speaker, sir, have a functional sub-county hospital in each sub-county as stipulated in the Ministry of Health guidelines, Mr. Speaker, sir. This can be done in phases as multi-year projects. Mr. Speaker, sir, the department should ensure that all completed health facilities are operationalized. The health department should liaise with the Department of Water to ensure there is constant supply of water in the facilities, Mr. Speaker. The department should liaise with the Ministry of Energy so as to ensure that all health facilities, Mr. Speaker, sir, have reliable electricity. The number of revenue streams and the amount collected in the financial year 2023-2024. Mr. Speaker, sir,
as you take your water, I will give you a chance to research on standstill period when later on will be responding because you didn't tell us what it means.
Thank you, Mr. Speaker.
Thank you.
The County Assembly, in compliance with Section 133 of the Public Finance Management Act 2012, approved the Kericho County Finance Act 2023. Its application being 1st January 31st December 2024. But Part 4 of the Act highlights the fees and the charges to be collected under the Health Services Department. The charges to be collected shall be as per the current Health Service Charter of the respective health facilities. The Speaker, sir, the Health Department has 6 sub-county hospitals where they generate revenue from different services offered to the citizens. The Chief Officer and Medical Superintendents in the Level 4 and 5 hospitals are the receivers of revenues, as duly designated by the CECM for Finance and Economic Planning, which is in compliance with Section 157 of the Public Finance Management Act 2012. The committee observed the following. Mr. Speaker, sir, very important part. The total revenue streams for the hospitals are as follows, which is down there. Mr. Speaker, sir, the committee observed that the total FIF cash remitted to the facilities is Kenya shillings 150, 746, 035, and the reimbursement from the SHIF